Developing now, unvaccinated healthcare workers all across the country are choosing between their jobs and getting the COVID-19 vaccine. And here in Michiana, 3 major health systems are requiring all employees to be fully vaccinated. 16 News Now reporter Jack Springate joins us live in Studio B to tell us why one study says unvaccinated employees are more likely to move on than to get the shot. Jack.
Well, Lauren, all employees at St. Joseph, Beacon, and Spectrum Lakeland Health Systems will be required to be fully vaccinated against the coronavirus. Some are concerned this could hurt an industry already experiencing a low supply of workers dealing with a high demand for care. The clock is ticking for St. Joseph, Beacon, and Spectrum Health Lakeland employees to get vaccinated. The deadline for Beacon workers is October 16th. The deadline for Spectrum Health Lakeland workers is 2 days later on October 18th. We didn't hear from St. Joseph Health Systems by the time the story aired, but as we've previously reported, their deadline for proof of vaccination was September 21st. A spokesperson from Spectrum Health Lakeland says their staff is 96% in compliance with their vaccine requirement, meaning they're either fully vaccinated or were granted an exemption. They said the health and safety of Spectrum Health's patients, family members, community, and team members are a top concern. The COVID-19 vaccine, along with practicing safe behaviors, remains an effective tool in slowing and even stopping the spread of COVID-19. But that still leaves roughly 150 employees at risk of losing their jobs. One researcher says employees who still haven't gotten the vaccine are more likely to leave their job if faced with a vaccine mandate than get the shot, especially if they're part-time. Her data shows 38% of part-time workers are unvaccinated compared to 28% of full-time workers. Of those unvaccinated part-time workers, roughly 2/3 of them say they'd rather quit than get the vaccine. For unvaccinated full-time workers, just over half said they'd rather look for another job than get vaccinated.
So when we think about the hospital workers specifically, what it's going to tell us is that they would rather lose their job than to actually get the vaccine.
She said the top reasons for COVID-19 vaccine hesitancy in healthcare workers comes from concerns about potential long-term side effects and if it's been tested well enough.
The hesitancy is real, even among the healthcare community.
And you'll definitely want to stay tuned at 6 so you can find out what else is out there for people who are willing to give up their jobs to avoid vaccination. Until then, I'll send it back to you, Lauren and Terry.
All right, Jack, thanks so much for that update tonight.